two. We're joined by Tommy Ahlquist. Tommy, thanks so much for joining us to give us your perspective on both the medical and the development side of things. Of course, a former emergency room physician, successful developer here in the state of Idaho. How are you doing, Tommy?
We're doing really well. I can't. I've been on the phone more in the last 2 weeks than ever before in my life. Just trying to keep all our businesses online and working and getting everyone remotely. We have multiple businesses, and then just trying to help friends with their own businesses. There's a lot of nervous folks out there on what do I do? How do I react to this? And then on top of that, the medical thing, right? We own Salter Health, and so we're trying to take care of and help people. So it's never a dull moment. There's a lot going on. And Don, I think unlike any other time in my life, it changes so quickly. Literally within 6 hours, most days, things are changing, both on the business side, on the stimulus side of things, and then on the medical side. So just trying to keep up with it all, but keeping my family safe at the same time, and trying to social distance and do what we're doing. But how have you been?
Good.
You guys are busy.
We're the expression, we're all in it together, and that's so true. And it's also new to all of us to actually be cooped up inside, though we encourage people to go outside for a walk, keep your distance away from your neighbors and stuff like that, and reacquainting ourselves with our families. I think I've played more games of Yahtzee in the last 2 days than I have the last 10 years, to be quite honest with you.
I agree with you, and Monopoly has been our favorite over the last week, and I was in a heated game till about midnight last night, and I will report, Don, I won, so I feel pretty good about last night. I haven't won the last 2 times. I have some cutthroat folks in my family.
Yeah, we try to keep away from Monopoly. It gets a little too aggressive, shall we say. So hey, let's talk about the medical side of things real quick, and then I want to get into some of the things, how this is all affecting your developments happening around the valley and around the state. At Salter, what are you doing to help people along during this pandemic?
Yeah, so first, Don, I'll start with my biggest frustration, and that is testing.
Yes.
Boy, as a country, we knew this was coming. We knew it was coming, and we missed it. We should have been more ready with testing. And I'm not blaming the federal government, the state government, or private sector. I think everyone had a hand in this, and it caught us flat-footed. And frankly, here we sit the end of March, and we still are flat-footed. If we would have had testing early, we could have tested almost everyone that wanted to test and just quarantined those that had it, and really coned in on who needed to be quarantined, and let this thing not be so devastating to our economy. But we don't have testing. Right. Our only answer and our only solution here is to social distance. And so what we're doing out at Salter is every day I get a report on how we're doing on testing. We actually have more testing available now than we have, so people can go get tested. The guidelines continue to get loosened up even more, Don. That's the other big change, is early on, you had to have traveled to a foreign country and had the symptoms. Then It became, okay, now you've been exposed to, you've traveled to a state, to a part of the United States that's had the disease. And then now it's loosened up even farther than that. So since then, we're testing people that have been exposed to someone and have some of the symptoms, but that is way easier to get a test today than it was even last week. So I'd encourage people that think they've been exposed to get in and get a test.
We're trying to speed up the process. I know there's a lot of smart folks out there trying to speed up this process of the testing. Of course, getting the kits out is another totally different issue here. But let me ask you this, Tommy. I mean, because I've heard this brought up, and we were talking about this the other day, that if you get tested right now, it takes, what's the fastest time you can get the results back? Is it 48 hours?
Yeah, well, so here's the problem. These PCR tests are minutes it takes to run the sample, but the problem is the lab we use for Salter is in California. So we do the nasal pharyngeal swab, put it in a transport, get it down, it goes to the lab, and now you've got hundreds of thousands of tests from all over the United States jamming our labs up, and there's only so many labs. So the actual test takes minutes, but the turnaround time, we're still being told, is 7 days. Now, every day it went up to 10 days. It's now down to 7, and hopefully that keeps getting shorter and shorter for us. But the actual test is minutes, but the turnaround time is way too long. So then what do you do when you're waiting for your test?
That's what I was just going to say. I'm stating the obvious here. You get tested and you feel good. I got tested. Now you're going to wait days for the results. But in the meantime, between point A and point B, you may have been exposed to somebody who has COVID-19, and then you get your results back from California and says, hey, you're fine, but you're not.
But you're not. And so it's been the most as a provider, it's been frustrating. As a patient, it's been frustrating. And as someone giving advice to people that have loved ones, and how do I avoid this? What do I do? I have a few, I mean, Don, can you imagine the calls I've gotten from friends and family and acquaintances that have said, here's my story. What should I do?
Sure.
And the easy answer all along would have been go get tested, and we get a test back, and it would have helped us so much, but we don't have it. So some of this testing thing is, the bottom line is it's getting better. It's getting better quickly. And I would anticipate over the next couple of weeks, they're going to have testing that is much quicker turnaround time. It's going to help all of us. But the problem, Don, is, Sunday night I was on the phone with one of my old ER partners in Blaine County, Dr. Torres.
Right.
And we released a podcast on that. But we don't have 2 weeks. We don't have 2 weeks, just like he didn't have 2 weeks. It is all around us, and it's going to come and overwhelm us if we're not careful. So as much as we'd like to say, hey, in a couple of weeks, we're going to have testing, that's too long. We need to socially isolate now and really take this very seriously. And the other point I would make is, 97% of people are going to get better. They're going to get better. It's those 3% that are going to require those ICU beds. That's what we're talking about. And it does not take much to overwhelm the system. Treating respiratory viruses is very labor intensive, meaning you have to give nebulizer treatments. There's all the equipment you need, and then they need to be intubated. It does not take long to overwhelm our system. So I'm really, really happy for everyone out there taking it seriously and isolating, but that's our only shot right now, is to do that.
What plans can families do? And I have to admit, I'm probably as guilty as a lot of folks down the street. If someone in your family believes they have it, or even gets tested having it, what should a family do, and how can they prepare for that inside their home?
So the one thing, there's a couple real concerning things out of my conversation with Dr. Torres. One, he told the story of someone that was in a skiing accident and got a chest x-ray with no complaints of the virus and had COVID-19. They found it on a chest x-ray. So you can feel healthy and normal and have the disease. It's just early in the disease. So you don't have to have symptoms to be carrying the virus. That's really important to make sure that everyone understands that, making social isolation even more important. But if you start having a dry cough, feeling poorly, feeling fluish in the way you're feeling, and having a low-grade fever or even a high-grade fever early on, those are the symptoms early on. The other thing that he brought up is almost every patient he's treating up there loses their sense of smell with this early on.
Yeah.
And he thought, when he read that at first, he thought, that's nutty. I've never heard of that. So then he started asking his patients, and he said that absolutely is coming with this. So if you have any of those symptoms, you have to isolate yourself. You have to strictly isolate yourself. Get the test. So you can go into Stalter today and get the test. We're trying as hard as we can to get them back. But while you're waiting for that result, you have to isolate yourself, because you indeed could be spreading it to your loved ones and everyone else.
Right. Don't think I haven't opened up a couple of jars of salsa just to make sure my sense of smell is still there. And so far, so good. But mentally, it does play mental games with you, because people will start saying,
Sure.
well, yeah. Someone will say, did you smell that? And you're like, no, I didn't smell anything. Or, but those are the things that we need to do. Quickly, you mentioned Dr. Torres up in Blaine County, one of the hot spots in our state. How are they doing up there in Ketchum?
It was really one of the great things about my interview is we take for granted first responders all the time, right? And now you've got people on the front lines that are really isolating themselves from their families throughout this entire thing. They're going into work every day and taking care of patients, all dressed up. Over half of the staff in the ER up there have been positive with COVID-19. And so they're really on the front lines with this potentially very, very harmful virus, treating people. It's very touching to me to know that my friend and my partner is doing it. And you know what? He actually said in the interview, it's not excitement's not the word, but he's like, this is what I've been trained for. This is what I've been built for. This is who I am. And I love going in every day and trying to help people. And so thank heavens for folks like that. But it's gut wrenching what's going on up there.
For the percentage of 75 to 80% of the people who get it they'll have mild symptoms, or some people may not even know they have it. I think it's interesting, and talk about this being a former ER physician, that once you have it and it goes basically through your system, you build up this immunity. And these are the people that everybody says we need to get those folks back out in the workforce. But there has to be a process of some kind to figure out who's had it, who doesn't have it, who's immune from it, so we can get them back out there.
Yeah, and that's so the way this works in your body. So bacteria invade your body, but it doesn't get inside your cells. These viruses actually infect your cells. And so then you need to have your immune system, your immune cells find the viruses in the cells and create antibodies against the virus. Now the good news, early on, it seems like this virus is not mutating quickly. So if you do develop antibodies in your body against the virus, it appears right now that is lasting. Time will tell that, right? Because we will know more in the coming months and years to how good that immunity is. But that's another blood test, and it takes time to develop those antibodies against the virus. So you're right. The good news up front is it looks like we do create antibodies against it. It looks like that it's a lasting immunity to it, and then we'll just need to start testing to say, okay, have you had it? Are you feeling better? And do you have the antibodies to it? And get back to work. That's our hope as this thing goes on. But who knows? I'm asked all the time, how long is this going to last? I can't tell you how many calls I get a day saying, hey, how long this is going to last? And I don't know. I'm really hopeful, Don, that this social isolation is helping us. I'm very hopeful. It's got to be. And I'm very proud of the people that are taking it seriously. So hopefully we're flattening that curve, but I don't know how long. It's
Right.
at least a few weeks. It's at least a few months till we hit the peak. And then we got a plateau. If you look at the curve, I mean, it's really nice that the curve goes like this and we're flattening it, but it lengthens it out so long that we're in this for a while.
Oh, I agree. And I think, but you're right. Best case scenario, maybe midsummer, we could get some way back to normal. But I've also heard uh, we could see a possible second wave when the Southern Hemisphere countries, a lot of them third world countries, go into their um, winter. As we go into summer, they go into winter. And we're such a global community these days that we might be coming out of it, but we have to be careful. These other countries might be it's like get in line first. We had China, and then Italy, and then Spain, and then the US, and then is Brazil, and are those countries in South America and Africa going to be 3 months behind us?
Yep. And then when they have it, then it's going to come back. And there's always a second bump in these, right? Usually, I mean,
Right.
usually there's the first bump, you take care of it, and you go to the second one. So I think we should prepare for that. But what we're trying to buy is time, because if we get a vaccine and we
Mhm.
get some medications that are effective against this, then that second hump is a completely different battle, because then we have some time on our side that allows us to prepare the vaccine and treatment for this.
Is a vaccine, we hear people, just getting on a fast track. It's I think we used the analogy this morning. We were talking about it. As someone says, I know how to build this car. I just need these certain parts to build it. But if I don't have this part and this part to this car, it's going to take me 12 months to build it. I know how to build it. I just need the parts. So I guess the question is even though we have a lot of smart people trying to figure this vaccine out, and some people say best case scenario, maybe this fall, but it's on a different timetable, isn't it? You need these parts.
You need these parts, you need time. And that's one of the things that Jim Torres and I talked about. This thing came on, it hit us so quickly that everyone was caught flat-footed on every level. And so now to ramp that up and get the vaccine, the science behind it produced, and then get it produced in a quantity that can get delivered and be used as a vaccine, I think falls the best case scenario. But I also tell people I'm very optimistic that what I've seen in just 2 weeks is once the American people we are very innovative. We are very entrepreneurial. I think we will see an immediate response on the PPE side, on the vaccine side, on the testing side. If the government can help us with some of those regulations and fast tracking some of these machines so they can be used for testing, and the vaccine, it needs to be safe, but there's a way to do it safe and cut through a lot of that bureaucracy and red tape. And I've got to believe the government, both at the state level and the federal level, is going to help in every way they can to take something that usually takes a very long time and fast track that for our people.
Tommy, how will a vaccine, once we have it, and we will get it, be administered to the general public? Do you have any idea how that will happen?
How it will be released and be, so it'll be released through suppliers of medication after it's produced, and you'll be able to acquire. So Salter will be able to
But I mean,
acquire
would
that.
at risk folks be in front of the
Sure,
line?
absolutely, yeah, absolutely. So just like, and then if you've got comorbidities, if you've got risk factors, those first doses of those vaccines will be available for you, and then more to the general public as it rolls out. And it'll either be a nasal vaccine or a shot that you'll have, and hopefully those quantities are of such number that we can just get it out to everybody to avoid that next hump.
Will it be, try to visualize this, the way what we're doing testing where people are pulling into parking lots in their cars, do you see the vaccine being administered that way?
Well, I wish, hey, that's real hopeful. I wish it all came that quickly that we could all go out and get it, like a Costco run, but it's probably going to drip out a little bit more than that. What I think will happen is your doctor's offices, the hospitals, the healthcare providers will get limited quantities and then have you go see your doctor, get your vaccine that way, whatever clinic you're at. But I don't think they'll be able to do, the quantities will be such. The other thing we have going on here, Don, is, we're competing. This has been an interesting thing. We're competing with medical supplies and vaccines and medications with the world. And I spent several days last week on the phone trying to get supplies for Salter. And I was on the phone with national buying experts for 2 days straight. And several of them would just laugh at me and say, do you realize that we're competing with countries and they're not going to let supplies out of their country? And then within the United States, let me take it one more level. You've got giant urban centers with hundreds of thousands, millions of people fighting for the same supplies. And here we are in Idaho fighting for our portion. So as
the masks,
the masks, the drugs, think about albuterol. You only have so think about all of the things you're going to need to treat a COVID-19 patient. Right. Every one of those things are in a supply chain at somewhere along the way. And a lot of them come from foreign countries. We have let a lot of the manufacturing in this country, starting in 2003. So for 17 years, a lot of our manufacturing has been shipped out of this country. And we have set ourselves up where we are completely reliant. We'll give you one example. One of the manufacturers I was trying to get things from was from Italy. And they're just like, well, you're not going to get any medical supplies out of Italy right now. You're just not. And much of it comes from China. So I think one of the good things that'll happen is we'll move a lot of that manufacturing back.
So everybody's heard about the curve by now. So what we can do is self-contain and keep the distance and watch out for the symptoms. But this is essential, and I know you'd like to comment on this, if we bring the curve down, that takes the pressure off our healthcare system, because especially in areas like Seattle and New York City, where the healthcare system is bending, but how far can it bend before it breaks? And I don't mean to be a pessimist about that, but these hospitals in New York and Seattle, they're almost throwing up their hands, and those doctors and nurses are doing great work, but unless we can get that curve down, correct?
Yeah, I mean, Jim Torres said it best to me on Sunday night. Think about what happened in Blaine County. It is a disaster up there. And what they're doing right now with their patients, he admitted 4 COVID-19 patients in an hour, one of his last shifts. They are putting them in an ambulance or a helicopter, and they're shipping them off to Twin Falls or Boise. So right now, their pop-off valve is they can ship those critical patients to Boise and Twin Falls. If this disease spreads like it did in Blaine County, in the Magic Valley or the Treasure Valley, and we have such a population that is so many more people here, we have such limited beds and capacity to care for the respiratory illness that this is causing, that the capacity, you say the bending, the point at which that breaks is when you don't have a ventilator for that next patient, or you don't have enough respiratory supplies. So that is why it's so critical for everyone out there listening. We're doing this for our own families, but we're doing it so that you are keeping that peak down to where we can take care of these patients. We are blessed and fortunate. We have amazing health systems in this state. Look at the quality we have with St. Al's and St. Luke's here. They are ready, they are professional, they are cutting edge in every way, but they only have so much capacity. And that is what we as the public and the community need to do, is let's really take advantage of this time we have to distance and minimize that capacity issue that they might have. And if we can get by that long enough, we can get through this and then get back to work. Because that's the other thing we haven't talked about, is the economic devastation.
I was just going to ask you, right, we could talk about the ER rooms with your expertise all afternoon long, and I'm fascinated by the conversation. But from the business standpoint, you employ a lot of workers out there building in every direction, it seems. How do you see that playing out over the next 4 to 8 weeks?
So first of all, so everyone listening today that owns a small business or is part of a business, the stimulus package, starting tomorrow, we are told you can start applying for those stimulus dollars. And there's a process to go through. I actually did another podcast today with my CFO, because I want people to know that if you're not getting those applications ready now, it will be a first come, first serve. And we want Idaho, our businesses that need to survive, to be able to get in line so that they can get that needed support. So the first thing is make sure you're getting in line right now, today, with your business for those dollars, because it will help you get through this. But yeah, if it's going to go 3, 4, 5 more months and you don't have any revenue or income, and people are sitting around waiting to get back to work, potentially devastating to a lot of our small businesses. We are a country that's built on small business. We have a few large businesses with plenty of money in the bank that can weather this, but our country and our state is built on small business, and they will be hit the hardest by this. So get those stimulus dollars. And the other thing I would say to everyone, I mean, I went through that last recession, Don. I remember I was still an ER doctor, and Portico, where Buffalo Wild Wings is, that was my first project. And many people will remember there was steel in the air. The banks called and pulled all of our loans. They said, you don't have any more loans, we're done. And I remember laying there in bed. I remember coming home from an ER shift and sitting in my driveway and not wanting to get out of my car, thinking, I've ruined my life. There is no way out of this hole I'm in. And I would also tell anyone that's in that situation, you've got to sit down with a piece of paper and say, what's my plan to get through this? Where is the light at the end of this tunnel? And then have a plan and a strategy, and then work your tail off to get there. But this is going to challenge every business person out there, because most people do not have that kind of equity to continue to pay people and to continue their businesses when there's just no dollars coming in the door. And that's the other part of this. The better we are at flattening this, and as a community, and it will be there'll be different sections of our state that are hit harder because of how they do on this flattening of the curve. The quicker we'll get back to work too. So that's the other reason to really comply, is to try to minimize the impact on the business community.
And we'll just kind of wrap things up by saying that if we can take comfort in knowing that there is a beginning, there's a middle, there's an end.
There will be an end. There will be an end. And this thing will get over, and we'll look back on it. We'll learn a lot from it. The last thing I'll say, Don, how businesses, how we treat people during this downturn, during this crisis, will define who we are. It will define who we are individually. It will define who we are as businesses. It will define our communities. And if we can come together and really focus on the positive and look out for each other as a community, let that be how this crisis defines us. That we came together, we figured it out, and we got through it, not that it tore us apart. And these things happen in our lifetimes. And if we can come together on this and help each other through it, that's the message for everyone. That's where we are, because this will define us as a society, as a community, and individually.
One day we'll look back on this, and hopefully it'll be a distant memory, and everybody will have plenty of stories to share with each other. So we all just got to do our part individually and as our families, and hang in there. Tommy Ahlquist, thanks so much for joining us. We may do it again. I hope we don't have to, but maybe somewhere down the road we'll do this again and kind of get an update from you and how things are going with your.
Thank you. Be safe, Don. Thank you.